Today, I would like to talk about a health condition that affects millions of men around the world, especially as they grow older. Many people are not familiar with its name, but they are familiar with its symptoms. This condition is called benign prostatic hyperplasia, commonly known as BPH. First, let us understand what the prostate is. The prostate is a small gland found only in men. It is located just below the bladder and surrounds the tube called the urethra, which carries urine from the bladder to the outside of the body. The prostate helps produce semen and plays an important role in reproduction. As men age, the prostate gland naturally enlarges. This enlargement is called benign prostatic hyperplasia. The word benign means that it is not cancer. However, although it is not cancerous, it can still cause troublesome symptoms and affect a person's quality of life. BPH is one of the most common health problems seen in older men. It is uncommon before the age of 40, but after the age of 50, many men begin to experience urinary symptoms. By the age of 80, most men have some degree of prostate enlargement. Many men think these symptoms are just part of normal aging and therefore ignore them. However, early recognition and treatment can prevent complications and greatly improve quality of life. What are the symptoms of BPH? The most common symptom is frequent urination. Some men feel the need to pass urine every hour. Others wake up several times during the night to urinate. This repeated interruption of sleep can lead to tiredness and poor concentration during the day. Another common symptom is difficulty starting urination. The person may stand in front of the toilet and wait for several seconds before the urine starts to flow. The urine stream may become weak, intermittent, or slow. Some men feel that they have not completely emptied their bladder even after passing urine. Others may experience urgency, where they suddenly feel a strong need to urinate and cannot delay it. Some may even leak urine before reaching the bathroom. These symptoms may seem small, but over time they can affect sleep, work, travel, social activities, and emotional well-being. What causes BPH? The exact cause is not completely understood, but aging and hormonal changes play important roles. As men grow older, changes in male hormones stimulate the growth of the prostate gland. This enlarged prostate compresses the urethra and makes it difficult for urine to pass normally. Who is at risk? The most important risk factor is age. Men over 50 are at greater risk. Family history, obesity, diabetes, lack of physical activity, and certain lifestyle factors may also increase the chance of developing BPH. Can BPH lead to complications? Yes. If left untreated, BPH can lead to serious complications. Some men suddenly become unable to pass urine at all. This condition, called acute urinary retention, is painful and requires emergency treatment. Other complications include repeated urinary tract infections, blood in the urine, bladder stones, and damage to the kidneys due to long-standing obstruction. Therefore, urinary symptoms should never be ignored. How is BPH diagnosed? The doctor will first ask questions about the symptoms and how they affect daily life. A physical examination is performed. Urine tests are done to look for infection or blood. Blood tests may be ordered to assess kidney function and to measure PSA, or prostate-specific antigen, which helps doctors evaluate the prostate and rule out cancer. Ultrasound scanning is commonly used to assess the size of the prostate and determine whether urine remains in the bladder after urination. Sometimes additional tests are required depending on the patient's condition. Can BPH be treated? The good news is yes. There are many effective treatments available. In mild cases, simple lifestyle changes may help. Patients are advised to reduce fluid intake before bedtime, avoid excessive tea, coffee, and alcohol, maintain a healthy weight, and stay physically active. Doctors may prescribe medications that relax the muscles around the prostate and improve urine flow. Other medicines can gradually shrink the prostate gland. These medications help many patients and can delay or prevent the need for surgery. If symptoms are severe or complications develop, surgery may be necessary. The most common operation is called TURP, or transurethral resection of the prostate. In this procedure, the enlarged prostate tissue is removed through the urinary passage without any external cuts. This operation has helped millions of men regain normal urination and improve their quality of life. One important point I would like to emphasize is that BPH is not prostate cancer. However, both conditions may occur together, so proper medical evaluation is important. To all the men listening today, if you are experiencing frequent urination, difficulty passing urine, weak urine flow, or repeated trips to the bathroom at night, please do not ignore these symptoms. Speak to your doctor and seek proper advice. To family members, encourage your fathers, husbands, brothers, and grandfathers to discuss these symptoms openly. Support and awareness can make a huge difference. In conclusion, benign prostatic hyperplasia is a common condition affecting aging men. Although it is not cancerous, it can significantly affect quality of life and lead to complications if untreated. Fortunately, effective treatments are available, ranging from simple lifestyle changes and medications to modern surgical procedures. Remember, growing older is natural, but suffering in silence is not. Early diagnosis, proper treatment, and healthy living can help men enjoy an active and comfortable life. Thank you very much for your attention.